Good morning, everyone. So in this video, I want to discuss with you something called Imposter Syndrome versus Dunning-Kruger Effect. And this video will be mainly about Imposter Syndrome, and in a second video, I will discuss Dunning-Kruger. And I will discuss it with you from how to deal with associates in your practice that could be having this effect on them, or also if you are a dentist or an associate dentist that might benefit you as well, or even a practice owner might benefit you for yourself. So first, for credibility, my name is Khaled. I have been a dentist for 20 years, and I own my dental practice, Lakeside Dental Spa in Hervey Bay in Queensland. And I took my practice from 1 chair to 10 chairs over the course of 14 years. We started with staff member of 3 staff members. Now we're close to 40 staff members. So first disclaimer, this is a very complicated topic, and I wanted to research on it as much as you can. I'm not a psychologist. I'm just giving you my thoughts on it. If you like my thoughts, you can hopefully benefit from them and research more. If you don't like my thoughts, you can just move on to something else. So imposter syndrome. So in a summary, what it is there are too much self-aware. You're too much self-aware of yourself. So there is doubt of your intellect, your skill set, your accomplishment, and that can cause a lot of anger and anxiety as well. It's usually triggered with a lot of childhood issues, especially with parents' expectations sometimes. So let's break it down into different things. So let's say you are an associate, you are in your first year out, and how can you make sure that you're suffering from imposter syndrome, not from something else? As an associate on your first year out, or dental first year out, your main skill set is basic dentistry, not dental implants or orthodontics, just diagnostic skills, and also simple dentistry like filling, simple extractions. So that's where your skill is, because you've studied dentistry for X amount of years, you're graduated from dentistry, so you should be in a good place to at least do the basic dentistry. So let's say you're doubting yourself the whole time in simple stuff like fillings. You think that your fillings are not good enough. Patients are not happy with your fillings. They're always complaining about your work. Your fillings look horrible. You can't get good contacts. Every crown you made is not good enough. And you always talk to yourself in a very negative way. How do you know whether you suffer from true imposter syndrome, which means you have the skill, you have the accomplishment, you just doubt yourself, or whether you're actually not that skilled and you need to improve? How do you know that? Because sometimes this could be your brain is telling you, hey, you're not good enough. That's true. You need to go and learn more. Or your brain just playing tricks on you because you're good enough, you're just doubting yourself. So how do you know? My advice to you is analysis. Look at facts and numbers and figures. Numbers and figures and facts do not lie. I'll give you one example. Let's say you're doubting your skills in fillings. Like you believe that all your fillings have open contacts, margins are poor aesthetics, you don't get the shade right. Patients are complaining about your fillings are breaking and falling away, always teeth are sensitive. You're doubting your skill to perform basic fillings. So what do? Facts, numbers, and figures. First, good records. Make sure you have photographs of all your fillings as much as you can. If that's something's bothering you, so start taking photos for you before and after. Posterior fillings, anterior fillings, bite wings, if you want to check contacts and margins. Have good data. So record as much facts as you can, which is photos. And now we have scanners, you can scan as well, bite wings. Then collect as much information as you can. How many fillings you've placed, let's say in 3 months. Let's say you've placed 90 fillings. How many fillings came back broken? How many fillings came back patients complaining with post-operative sensitivity? How many fillings end up with a loose contact, patient coming back with full impaction? How many fillings ended up with open margins that you had to redo? Patients coming back with wrong shades, they're not happy with the shade. Gather all your data. Then take all this information and go to someone with experience, a mentor you can trust. Could be a tutor in your uni, could be the principal dentist in your practice, someone in your area that's happy to mentor you. Even put it on social media, DPR or some of the groups where other dentists like myself, for example, I'll be happy to provide you with information that will give you good analysis. And then from there, the mentor will be able to let you know whether you're just doing really great in your skill, on your level of experience, and you're just doubting yourself, and then we'll talk about what to do then, or whether you're definitely not good enough. You need to improve. As someone first year out should be doing all this stuff better, and need to do 1, 2, 3, 4 to improve. So you need someone to help you determine that. So let's say you come to me, for example, with information, and I looked at all your photos and your numbers and realized, you know what? Based on what I'm seeing, your failure rate is probably close to 5% on each aspect. I would say that's pretty good for someone who is only on their first year. I think you're doing good. You still will improve. You'll get better, but I think you're doing good. You're doubting yourself. So that's imposter syndrome. But what can you do from there? My advice, and again, nothing wrong with that, if I reassure you, for example, and you're still doubting yourself all the time, and I have no problem saying this out loud, seek therapy. Having a clinical psychologist in your life early on in your career is the best thing you can do to yourself. I saw clinical psychologists later on in my career, and I wish I saw them early in career. You don't have to have a mental illness to see a clinical psychologist. You can see them as a preventative method or a preventative for preventive treatment. They can identify a lot of childhood issues. They can identify a lot of things in your personality trait and help you to perform at your top level. Top athletes and top performers, top actors, top musicians, they all see psychologists for that reason. They unleash their potentials. So make sure you see a good therapist or psychologist can help you through this process. Let's say the second scenario where you don't have imposter syndrome, and definitely I'll look at your numbers and say, okay, based on everything you're saying, your failure rate is close to 50%. That's really, really, really high for someone in your level. I think it's good that you're doubting yourself, and it's good that you're seeking help. You need to be better than that, 100%. Some dentists take them a bit longer time to develop skills than others. Your colleagues could be nailing everything from day one. You might need a bit longer time, but you need to get more training. Whatever you have been taught at uni obviously is not enough because you haven't got there yet. I recommend you take 1, 2, 3 course, take this residency. There's a lot of training you can do. Again, you can do a lot of training in that aspect. So you need training. You don't have imposter syndrome. You're definitely not good enough in that area. I say in a constructive way, not in a negative way, and you need more training. So gather information, take a lot of records, find someone you can trust or a mentor that will be giving you a good analysis, whether you are good, you just have imposter syndrome and you need to seek therapy to manage that early on in your career, or you definitely need improvement in your skills. Your skills are lacking. And you can apply this at any level. So let's say you have a practice owner for 20 years experience. You think your practice is not doing well enough. Again, find someone who's a practice owner with more experience who can analyze your practice and let you know what, based on your level of ownership, you're not doing well. You need to go and learn how to run a practice. Nothing wrong with that. Or they might tell you, your practice is doing great. Your numbers are off the chart. Your team seems like to have a good culture. You're doubting yourself too much. Seek therapy. Trust me. So at any level, if you're a high performer dentist doing large number of implants and you're suffering from the same, go for someone who's even more experienced and let them analyze your implants. You place 1,000 implants this year and you're doubting yourself, and they can analyze your failure rate. You're doing block grafting and they're all failing. They can tell you you're not good enough. You need to learn to do it differently or start repairing them out. So you can apply this principle at any level. So if you find this information helpful, make sure to like and share it. If you want to hear more about my videos, subscribe to my channel. I will notify you when more videos are released. In the next video, I will explain something different, which is the Dunning-Kruger Effect and how to deal with it as well. Thank you so much for listening, and it means a lot to me.